relatives and my friends and colleagues and new friends that I met on support groups that I wouldn't have met otherwise, except for having been diagnosed with breast cancer. I see Laura has also been a wonderful mentor in addition to Debbie. One of Laura's favorite or famous sayings is that, you know, breast cancer is like joining a very exclusive club. And so the women that you're going to meet there are all wonderful and have gone through this very interesting experience. I'm not going to say negative and I'm not going to say positive, but it was definitely has its ups and downs. But when you have a group that have walked the same path, then it is a different kind of bond that you feel with everybody because they know firsthand what it's like. And, you know, your friends and your family can be supportive, and they are, but to have gone through breast cancer treatment successfully, even, then that's something that is quite unique. I want to say that in addition to having gone through breast cancer treatment, it was also a global pandemic with COVID. So that really also changed the dynamic with breast cancer being kind of a difficult process to walk, but then it's magnified even more complicated having the restrictions that COVID presented, with having support from relatives coming into town to assist, even to have my husband attend the appointments at the hospital. There was COVID procedures, so there was no extra visitors. So a lot of the journey I had to walk by myself, but feeling the prayers and the love and the strength of those pulling for me at a distance. But you know, it was a very complicated path. I started my breast cancer diagnosis in August of 2020, which was the height of the COVID pandemic, and also the schools were closed. I have two children of my own. They were 11 and 13 at the time. So I work for the school system at Miami-Dade County Public Schools. So we already had the technology in place because the schools closed in March of 2020 because of the COVID pandemic and the risks. So this was a huge endeavor with having the technology in place to continue to work and to get treatment and to even have support groups on Zoom. So there was a lot of good that came from the technology. So I really want to emphasize that it wasn't all a struggle. There was a lot of wonderful things that came out of this experience for me. But what I would like to do today, I have some art pieces that I want to show that I created during my 11 months of active treatment and then the recuperation for a couple months after I had, let's see, 4 months of chemotherapy. Then I had a double mastectomy with lymph node removal. Then I needed physical therapy to regain range of motion in my chest and upper body. And then I needed radiation, I needed 28 rounds. Then there's the healing from the radiation. Coincidentally, this coming Wednesday is my surgery for breast reconstruction. So this is now another leg of that journey. So I am looking forward to that, and this opportunity to present for you and present all my artwork is really timely because it gave me an opportunity to reflect on all that I endured throughout this time and putting it in perspective. So without any further ado, I would like to share my screen. Okay, here we go. There we go. So as Debbie introduced, I am a clinical art therapist. I am registered and board certified. I had my master's degree training at Pratt and also the School of Visual Arts. And like I said, I work as a professional clinical art therapist with students that have special needs. So simultaneously, while working with them, I was also then having the opportunity to do my own art. So for this presentation, I would like to just spend a couple minutes talking about art therapy before I go and show my personal artwork. Okay, so there's my intention for today is a brief overview, because art therapy is such a fantastic profession and modality for a lot of different treatment settings. I know at Miami Cancer Institute, the Sylvester Institute with University of Miami, they have an art therapist on staff. There's also the Arts in Medicine program at a lot of other cancer institutes. So there is a lot of opportunities to use art therapy as a modality for healing. I would like to share my personal artwork while in active breast cancer treatment during the COVID pandemic. I want to also emphasize the power of visual symbols in making art and having that as a resource to summon courage, grace, and resilience and humor during a health crisis, especially having to go through this on my own and being brave, waiting in the waiting room. So that was a wonderful tool to use. I hope that my story will inspire others to be creative and to use their art as well, whether it's music or dance or drama or writing. There's art is not only visual, there's a lot of different components. And I also encourage everyone to resume their health screenings despite the COVID pandemic. This was such a really shocking time for the whole world. And now we're on almost year 2. And oftentimes people have put off their screenings. And unfortunately, if there is an issue, then sometimes it doesn't get caught early. So early detection is crucial to a good outcome. So I would like to also just emphasize that point. Okay, so the profession. So cited from the American Art Therapy Association, art therapy is a combination of mental health, psychology, and visual arts. And you're using that as a way to express what you need and to get assistance and support as you go through different things. So I am just going to paraphrase because I'm looking at the time and I realize I don't have a whole lot of time left. So there is the American Art Therapy Association. I put the website here on the bottom. If you would like to explore this a little further, they have fantastic resources and explanations. So I do highly encourage you to check that out. So art therapists are master level clinicians who work with people of all ages across a broad spectrum of practice. There's ethical standards and there's a scope of practice. They are usually supervised in their work with other populations. So, and that's where the training really is very important. Art therapists can work in hospitals and schools, in veterans clinics, private practices, psychiatric and rehabilitation facilities, community clinics, crisis centers, forensic institutions, and senior communities. There is an overlap with the creative arts therapy and also arts in medicine. So I'm going to paraphrase really quickly. Art is fantastic for healing and for creativity. But if you look towards the left of the slide, creative arts therapies support personal and relational treatment goals within a therapeutic setting, which is professional art therapists. There's also the arts in medicine component, and that serves as an adjunct to medical care to support healthcare, and wellness, which is more of an artist in residence program. So those professionals don't necessarily have to get a master's degree, but they are trained and they should ethically be responsible for keeping within their scope of practice for what they are trained for. So I just want to say that there is some overlap. And this slide was provided by Dr. Christine Strang. She's an art therapist and neuroscientist. I'm going to go through these slides really quickly. These were gleaned from the work of Dr. Janet Bush, who is a clinical art therapist and pioneer in school art therapy. And so this again is talking about the different criteria of art therapy, which is on the left side, and the therapeutic arts, which is more about the arts and medicine component on the right side. But I'm again looking at our time and I want to be able to show my artwork. So I'm going to sort of just breeze through these so I have enough. For those interested, there is the American Art Therapy Association. If you wanted to find an art therapist, these are the websites that you can check out. So my story, navigating breast cancer treatment during the pandemic. So I was diagnosed in August of 2020, and I'm still going through treatment. Like I said, on Wednesday is breast reconstruction. So some wonderful things is that the technology was already in place for online learning. So I worked throughout my entire cancer treatment. I was able to work from home virtually with my students, and it was exhausting and tough, but it was also a great learning experience for them because there are also people in their lives that have gone through cancer. So this was a unique opportunity for my students to ask their questions and to also observe that things get better. The hospital safety protocols we had talked about, my husband couldn't attend any of the appointments unless it was a really special occasion, like meeting a provider for the first time. They were really strict about not being contaminating or reducing the risks of contamination. My children couldn't attend school physically for that whole year for the risks of possibility bringing COVID home while I was immunocompromised on chemotherapy and during the other treatments. So this whole experience really also took a toll on them as well. So this is my office, and there's a bunch of greeting cards that I would stick on the wall as reminders of everybody's love and support, because again, there was restrictions of having anybody come round. So putting in the mindset of finding the silver lining in all of this active treatment and recuperation storm clouds. I was so thankful to my church community, my daughter's Girl Scout community that would bring meals contactless. They would drop them off on the porch and leave, and we would text each other, and that was incredibly helpful because again, not having my mom being able to come down and help, because at that point there wasn't a vaccine yet, and quarantining was difficult and risky. But again, the silver lining was that I could attend virtual breast cancer support groups and meditation groups from all over the world. And I definitely took advantage of that, and I didn't have to leave my house at all. My connections deepened with other breast cancer survivors, relatives, and friends from all over the country that would not have grown otherwise. So in a way, cancer was a blessing. So I want to just talk about the art symbols and the art process. That art doesn't only have to be painting or drawing, it could be collage, it could be research and drama, it could be sculpture, journal writing, music. So this is a very quick 2-minute video. My story was chosen by Miami Cancer Institute as a story of hope, and they created a little video. So I would like to share that with you now. There's a lot of treatment facilities all over Florida, as well as in the whole United States. But this is just where I got my treatment, and Dr. Wang being the head oncologist to spearhead this experience with me, and also Dr. Mountner and Dr. Medina and Dr. Rodriguez. So I will play this quickly. My name is Morgen Chesonis-Gonzalez. I am a mother of 2. I have a son who is 13 and a daughter who is 11. I am a clinical art therapist. I was diagnosed with stage 2 breast cancer. It was actually 2 different types of breast cancer in the same breast. Of course, you feel like the world is going to end and the sky is going to fall. So I reached out to my primary care physician, and she was the one that was instrumental in recommending Dr. Mountner.
Morgan was diagnosed with what's called a triple negative invasive ductal cancer of the right breast.
And of course, then you just burst into tears because it was really upsetting. And then I have children, so you have all of these thoughts about how this is going to affect not only me, but also, my family.
That's the fear that most young mothers come in with. Like, I need to be here for my children. Please tell me that I am going to be alive to see them grow up, get married, graduate high school and college.
I put in my mind early that I wanted to see my grandchildren. And I was gonna fight like hell to make sure that I did that.
Not every patient that has breast cancer requires chemotherapy or requires radiation therapy or requires plastic surgery for reconstruction, but she needed it all.
I remember going to that appointment with Dr. Mountner, and she was so kind and so empathetic. It was, I guess, as good of an experience as you could possibly have getting this news.
All of her doctor's appointments were within one building. All of her doctors were within the same computer system and could communicate easily. I was always able to see the notes of her medical oncologist and radiation oncologist. Her plastic surgeon was down the hall from me.
My treatment at Miami Cancer Institute was wonderful. I was super thankful to have my treatment there with everything under really one roof.
Morgan had a complete pathologic response to neoadjuvant chemotherapy, and what that means is that there was no cancer left in the breast tissue or in the lymph nodes when we did her surgery. So this is the best pathology report that you can possibly get, and it means that her prognosis should be excellent.
This is my wreath. I don't know if you can see it so well. It is all of my wristbands. I still have a very long life to live. Okay. Okay, so now we're going to get into the creative part. So visual symbols are crucial in being an inspiration of this battle, this fight. And so this is a watercolor painting that I did to discuss then or showcase the visual arts, the writing. So I was journaling, music, I was taking photographs and documenting my process, and also the drama flares in the background. So that's one of my pieces. This is a colored pencil on paper, emphasizing that the outside of my silhouette is really looking very calm, but it's hiding the facade because the chemotherapy was really chaotic inside my head and caused some fragmented thoughts and chemo brain, as we like to call it. So that's one. I also photo documented my process. I got a selfie stick and I was using it often because, again, I couldn't have anybody go to chemotherapy with me. So it was almost like there was no one else to witness this process. So I needed to take photos of it so that I had this and can kind of reflect that, wow, I really went through this. And there was, like I said, 11 months of treatment. This is entitled Dancing with the Red Devil, Adriamycin. And I'm going through chemo therapy right now. The nurse is injecting it into my port line. And it was pretty tough stuff, but it worked. And I feel so thankful for that. This is a watercolor pencil on paper called Shield, and it basically displays my 4 months of the Red Devil, Adriamycin, and the Taxol cycles and how it had affected me, but it is a shield. So it's also a protective factor in how it physically made me feel, but I know that it was doing miracles and it was fighting this cancer that was inside of me. So it was really powerful. Because, again, having to walk this path by myself, I just finished watching a series on Netflix, and also it's on the History Channel. So I wanted to think of a historical figure that I could find and draw strength and inspiration from. And this was a fantastic historical figure named Lagertha, and she was a Viking Shieldmaiden, which in that culture, the females are allowed to fight arm in arm, neck and neck with the males. So it was kind of progressive, and it gave me just this sense of strength and courage. And I needed that as I was going through all of my treatment by myself, and especially in the waiting room. And so I was using this as a kind of a token to hold on to and to play in drama with. So I have my Team Lagertha shirt on, and at this point, I don't have any hair, so it was my chemo cap with my Viking braids like a Valkyrie. But I wanted to showcase that she was an actual person and has said to have lived within the 9th century. So I want to just show this really super quick clip. There she is with her war paint. And this was just, I really tried to get into this mode of focus and calm, and to know that all the treatments that were happening to me and the chemotherapy coursing through my veins and the medicines and the radiation and the surgeries, it was all for the purpose of going to war and going to battle against cancer. And as you can see then, all the females, strong female shield maidens, neck and neck. The fierce. So that was something then that I really found so helpful to hold on to, that fierceness, that resilience, that fighting spirit. And I have ancestry in Northern Europe and Eastern Europe, and the Vikings went and covered all of that area. So I kind of felt that I might have Viking blood in me, and I really needed to channel the strength of my ancestors to give me the courage um, to fight and keep fighting. Here we go. The other really significant thing was that I had henna, painted crown on my head for my final chemotherapy treatment. Henna is a natural plant that they grind up and it stains. So it's not going to be toxic or anything. So through 305 Pink Pack, was able to get a henna artist, and her name is Jade and Max, and she is on the left-hand side. We're outside on my in my backyard because again, COVID protocols and trying to be ultra safe. And she's painting Viking symbols of navigation and bravery and strength all around my head. That was for my final chemotherapy treatment. And I have my Shieldmaiden shirt on. So again, invoking a role of strength and courage to continue this battle. I also had used that idea of a Viking Shieldmaiden warrior as part of a survivor. So this is a nutcracker, a wooden nutcracker, but I customized it. Instead of it being like a holiday theme, I tricked it out to be what I saw as my Viking strength symbols. So you see, I have my war paint on around the eyes, just like Lagertha did. I have my sword and my breast cancer shield. I have a lymph node compression sleeve to combat lymphedema, and that's on my arm over here. I have words of survivor and courage painted on the bottom. On the back side is that Viking symbols of bravery that I had henna tattooed on my head. And there's Lagertha's name, Shieldmaiden, warrior. And on this other side, again, the symbols of warrior and Viking and being fierce and strong. And that I did with tempera paints and colored pencils. Fun at radiation. I'm about to conclude my presentation pretty soon, so these are the final few slides. It was also really important to have fun and be sort of lighthearted, because at this point of my treatment, I already went through chemo, which was pretty intense. I had my double mastectomy and lymph node removal surgery, and now had range of motion with physical therapy. And so this was the final kind of insurance that cancer was going to not come back, was radiation. So I had 28 rounds, but I wanted it to be fun and to just have this levity to it. So I had a friend who also went through cancer treatment, and she passed along her exercise pants that are wild and have really great themes and symbols on them. So every day for radiation, because you have to go every single day, I tried to put on a different pair of fun pants. And as I was going, it ended up being a conversation starter with other people in the waiting room and other staff, and even the receptionists. When I would go in to check in, they were like, "What kind of pants you have on today?" And it was sort of like this ongoing just moment of levity in an otherwise kind of serious and scary scenario. So these are some of my pants. And the larger picture is my final round of radiation. So you see I have cocktails on my on my pants and my Shieldmaiden shirt. And just with my double mask, and just this moment of joy, and that I did fight this and I did get through it. I did have a lot of radiation burns that you can't really see so well, but it's healing and getting better. Uh, the symbol for breast cancer in the metamorphosis is caterpillars transitioning into butterflies. So I also started to grow or raise monarch butterflies in front of my house. This is something that my daughter and I were doing together. And the vulnerability of the bald little caterpillar, this is one that I took a picture of, really resonated with me, having gone through chemotherapy and losing all my hair and feeling so vulnerable and fragile. Then I would help grow milkweed plants and have them there in my yard. And it was amazing that even here in Cutler Bay, Florida, that they were wild, and they would, the butterflies would come and lay their eggs, and then I would put them in an enclosure, as you can see in the net, and they would form in chrysalis, but protected. And then I would do some drawings about them. And then they would erupt and emerge. So I was able then to, almost like a Airbnb, to have them be protected, but wait until they were able to be healthy, and we would release them, my daughter and I. It was quite fantastic and a joy to watch, but emphasizing the symbols of breast cancer treatment and all the various metamorphoses and transitions that one has to go to or go through during this process. This is actually a chrysalis from my herd of caterpillars. So I tried to put that into some air drying clay. This is an emerging butterfly. It's in the round. So what I wanted to just really, for our purposes, just emphasize a couple little details from it. But there's the fragility, but also the beauty and the mystery of how this butterfly goes from a vulnerable caterpillar all the way up through an independence and flies away. And that's how I feel having gone through this breast cancer treatment. And this is my final slide. It is called the Victory Wreath. You saw it in the little video that they showed of me and the stories of hope. These are all of my registration wristbands. I have right now 101 of them, and coming upon this Wednesday, I will have 102, because that will be for the reconstruction, breast reconstruction component. So I created this wreath to really document how long my journey was and how involved and really miraculous that this whole process was. Inside, in the middle, is my port card and some other remnants from the medical components that I had to go through that assisted me on this journey, and it was successful. And I feel so happy right now that I am cancer free. I am going to lifelong be on medication to make sure that a recurrence doesn't start to erupt again, and be monitoring, every couple months, and then it'll be every couple years. But I feel that I'm in a good place right now. I'm definitely in a better health place than I was last year at the same time. And it's just amazing to reflect on how strong someone has to be when they really don't have another choice. And the art really helped put it in perspective, whether it was visual arts or whether it was drama with Lagertha, if it was music, if it was writing the journals, and then the friends that I met along the way in my support groups, and my relatives and my buddies from way back in the day, and also on social media. It's kind of amazing to see how this has progressed, and I feel so thankful for the opportunity to present this to everybody, and appreciate all of your love and support.